So I'm a board certified psychiatrist and I've helped over 170 PMHNPs gain clinical confidence in their psychiatric skills with diagnoses, treatments, and actually getting patients better results. And so in this video, we're going to be covering how to actually learn psychiatry and how to actually learn medical knowledge in general. So as a psychiatrist, I've gone through undergrad, getting a high GPA. I had 3.8 in college, taking a full course load, then going through medical school and learning the vast amount of knowledge that we learn in medical school. Basically, they call it drinking from a fire hose. Then I went to residency where I learned an entire field, psychiatry, in 4 years and still learning to this day. But the way that you learn changes. And the way no one has ever taught this stuff, they're just taught, okay, you read a book and then you learn something. But that's like level one of learning. And so what I'm going to break down is the learning pyramid and how different types of learning can get you different levels of results for the same amount of time. So for example, if you spend an hour doing this thing versus doing an hour of the other thing I'm going to teach, then you're going to learn way more in that 1 hour than you will for just the passive hour of just reading. So there's a concept called the learning pyramid. So I'm going to break this down and explain exactly how it works and how I was able to use this to succeed in all those different areas. So it's broken down into 7 different regions. 2, 3, 4, perfect. So we got 7. And so as we start at the top and go to the bottom, this is in ranking of efficacy of how effective these methods are. So the first one is lecture. This is pretty much just you hearing information, you listening to a podcast, an interview, some dude in your classroom just talking about whatever the topic is, whether it's a medical lecture, it's undergrad lecture, a nursing lecture, just talking. And the rate of retention of this is 5%. So it's not a lot. You don't retain a lot of information from this stuff. So that's why how many people can just listen to a lecture and then just take a test? Very few. You always have to do other studying on top of that. And I realized this in high school when I was taking AP level classes like AP physics and chemistry. And so we'd have our lectures, but then we'd be doing practice problems. And then you would review the information for the test again, and then continued onward in college and then in med school. Like I was able to get really consistently high grades because I realized that this was not enough. Lectures only gave you 5% of the retention. So barely, like, I don't even know why the lectures are so commonly done. It's a good way to get a first pass of an information, but to build the whole education system around it is asinine to me. The next is reading. And reading gives about 10% retention. So everything you read is 10%. So it's a little bit more than lectures because reading now we're getting more active. So that's going to be a trend that we notice going down this pyramid is we're getting more active. Lectures, 5%, you literally just sit there, your brain will tune in and out. Reading, you at least have to pay attention to the material. And when you pay attention to something, it tells your body and it tells your brain that, okay, this is something that we should start putting down more neural tracks for, and specifically taking this information and taking it to the hippocampus for storage. But reading is still passive. You're just reading the material. You can zone in and out very easily. It may not make sense to you, so you might have to go over something over and over. You're not applying when it comes to reading. And so that's the biggest issue with it. You're not applying. You're just, again, you're also just passively consuming information that someone else has synthesized and put together, not info that you specifically have done anything with. It's still more than lecture because you're actually doing something, like you're putting in effort, but it's still not the ideal method of learning. But these two can help get a foundation so that way we can go down to the later areas. You can't usually start with the later areas. You have to work your way down. So now we have audio-visual. So this is 20%. So this right here is an example of audio-visual. You listen to me speak, but then you also have the visual. So basically you're combining these two areas together to get the audiovisual. So it's more engaging. It's engaging more senses. And so because it's engaging more senses, especially if you have diagrams and stuff, like imagine if I just delivered this lecture, but I did it in like a written format. It would not be as impactful than literally just seeing this visual diagram. This will help you remember much, much better. So for your studies, right, if there's anything now, because you're trying to take stuff that's here and here. So if there's any stuff that's here that you can take to audio visual, now you're moving it up for retention. For example, we had a girl in my medical school class. She was an art major in college, and she was one of the top performers in med school. And so her strategy, she would draw out these beautifully laid diagrams of whatever medical concept we were learning. She would have these huge sketchboards. And so everything that she learned, she would put into an art kind of form and then draw it. And, that's something that I couldn't really do. I could make little sketches and things, but not like she did. But she was able to get one of the top grades in the class. So I think it's because she's making it more active. She's integrating audiovisual components to the information. So this is moving up the ladder. Then we have a demonstration. So for example, when I was in organic chemistry and gen chemistry, we would learn the concepts in class, but then we would go to the lab and we would actually be synthesizing things. We'd be doing chemical reactions. So that is a demonstration. So whether a person demonstrates something like, a professor demonstrates a lab experiment, a finance coach demonstrates, that gives an example. Think of demonstration like example. A finance coach will say, okay, this is how this person was able to save, $1,000 a month. Or a business example could be like, okay, this is how this person grew to 10,000 a month in their business. In the psychiatry field, right? This is me viewing one of my, attendings say, okay, I see this patient and I start Zoloft 50 milligrams. Okay, so now we're getting to the higher levels. So seeing that demonstration is much better than someone just lecturing about Zoloft, because now it's a real life example. So think of it like that way. So think about in your education, how can you start scaling this? How can you start getting more of these higher level modalities? Like if you're just listening to a lecture, okay, can you watch a demonstration of it? Can you watch a live enactment of it? For example, in PMHNP education, can you shadow? Can you volunteer? Because now you're going to remember much more seeing psychiatry and medicine practiced than you will from just listening to a lecture about it. So these are all passive learning methods. This is all you just intaking in information from various different modalities. And you can see how they get more engaging. And that's the key thing, engagement. They get more engaging as you do this. So now when we get to the active, now we are in group discussion. And this is where 50% comes in. So for example, for my school community, for my NP coaching community, our community actually won an award for how well it's grown over the past couple months. And so they flew us out to LA. We went to school headquarters and we engaged in group discussion. So I was meeting with a lot of the other winners who also did really well in their school games, in their school categories. But we were also sharing strategies about our business. Like, okay, I do this, this works for me, someone else does this. In fact, I started YouTube videos because I noticed that a lot of the other winners were doing organic content on YouTube. So I was like, okay, I need to start doing that. Another person's doing ads. And so like them telling me those things, I've retained it a lot more than if just someone just gave a lecture on how to like grow on YouTube, for example, or like how to grow a business. That group discussion was super, super valuable for me. In the medical realm, something that we do is, so a lot of medical schools have switched to what's called a team-based learning curriculum. So the way it worked for us was we would have lectures on some topic in the morning. Let's say we talked about depression. And then in the afternoon, we'd have a group discussion where we'd go through cases and then they would ask us questions like, okay, so what's diagnosis does it have? Okay, how would you end up working up this person? What kind of treatments would you give them? We discuss as a group. And so because when we do that, you remember it a little bit more because now you're kind of combining things, right? You're combining the demonstration because it's an active example. There's an audiovisual component because you're taking stuff from the lectures. Like, we were looking through the lecture slides and being like, okay, this is good. Okay, I think it's depression, but no, I don't think there's anxiety going on because I'm looking through the different diagnostic criteria. So you see how this group discussion can combine a lot of these modalities together. So being part of a group, and that's why workshops are such a big thing. So in the business space, there's always workshops, real estate workshops and conferences. Conferences are like a group discussion as well. So when you go to these workshops, these conferences, you're engaging, we're being much more engaged. You're not just passively absorbing information, you're actively contributing. And when you're actively contributing, that's when you remember things way more. So then this one is the main one that a lot of us are going to be doing, practice by doing. So this is the example of my attending, seeing a patient and me watching them versus me seeing the patient and trying to decide what I need to do. So one of the years I had the most growth in was our third year of residency. So third year for psych residency is the outpatient year. And so what happens is that they just give you a whole patient panel and they're like, okay, like now these are your patients, go see them, have fun. And so after the cases, like we would see a patient, let's say a patient appointment was 30 minutes. So I'd see a patient and then they were already patients of the clinic. And then, let's say they're having worse depression. And so I'm like, okay, they're on Zoloft 75. I think we should increase to 100. And then I would go staff it with the attending and I'd be like, hey, I think we should increase it to 100 milligrams. And so they would, so now we're engaging in group discussion. So the attending would say, yeah, so I think that's a good idea. You should do that. Or no, actually, I don't think we should increase the Zoloft because they're having a lot of side effects already. Why don't we switch over to Wellbutrin to target their low energy? And they also have ADHD, so Wellbutrin would be a better fit. So I'd be like, oh, okay. So that's practice by doing. I'm engaging in group discussion, but I'm actually doing the thing. And this requires me to synthesize all this information that I've learned. So I've read about Zoloft, I've read about its side effects. A big problem that psych residents and psych NPs can run into is you think, okay, bipolar, I understand it. I understand the symptoms, right? Like the dig fast mania. But then when it comes to practice by doing and you see a patient with it, but now suddenly the patient isn't answering your questions. So you can't ask them about their sleep anymore. They're super irritated, but now they also might have ADHD on top of it. And oh yeah, they had all this childhood trauma and now they're injuring themselves as well. This could be a borderline personality disorder going on. So you start seeing all the complexity of trauma history. Well, what if this irritability is like a reaction to that? The practice by doing, you run into all these obstacles that you have to counter that you wouldn't even think about if you're just listening to a lecture on bipolar or trauma. How you will learn something is if you do it. So if you're in college, you're in NP school right now, you're in med school, trying to figure out how you can get practice by doing is what's going to help. So for example, for us, medical school, you learn a whole bunch of different information. Like you just learn so much. In undergrad, I was able to get away with it by reading and taking notes and maybe doing some practice quizzes or making my own quiz, like that kind of thing. But mainly I would just be reading notes over and over again like that and then doing practice problems. But when it came to medical school, the volume was way too great. There was way too much that was happening. So I switched to doing Anki, flashcards. So by doing flashcards, what I would to do was synthesize all this information. So let's say there was a lecture that was given on bipolar. Well, then I would put the bipolar symptoms in the flashcard. And this is where practice problems can come in because now you're practicing by doing. You're not just, and this is a mistake that I made, was when I studied for my USMLE Step 1 exam, I didn't start doing practice problems until like 6 weeks before the test because I was like, okay, I want to learn all the information first and then do practice problems. That makes more sense. But I didn't do so hot on the exam actually. And so what I realized I had to change for step 2 was really ramp up the intensity of the practice problems that I was doing, because that way I can now learn from doing it rather than just listening to the lectures. And now for every exam after that, so USMLE Step 3, my psychiatric board exams, child and adolescent psych board exams, doing practice problems is the way to go, not just reading a whole book about it. And this is the number one thing that I would advise you to do if you're a student, trying to figure out as many practice problems that you can and just get them, whether it's from old tests, whether it's creating Anki flashcards, and then you practice those problems. Yeah, whether it's engaging in a group discussion with the other classmates, like and switching over to an active form is going to help you much more than passive. So all of these 3 methods are active. So now we've covered the top 6, and the number one by far, and this is something that I have started learning too. This is teaching other people. When I started my NP coaching academy, I thought I had a good foundational knowledge in psychiatry. But then as I was creating lectures for this stuff, I would start noticing all these little gaps coming in, like, dang, I don't know the dosage for this supplement, or dang, I'm trying to explain autism, but like I know how to sense people who have autism, but I don't really know how to fully explain it to other people. I'd be forgetting diagnostic criteria for stuff. Like, okay, I know BPD has the abandonment, it's got the self injuries, it's got the mood lability, the psychosis stuff, but like I'd forget some of them. And then by teaching, that's what makes me forced to relearn it, to remember it, and to be able to synthesize the information in a way so it's digestible to you. So for example, like this is me teaching you right now. So I'm going to learn this a lot better than if I just read it one time and saw it. So just the action of me teaching it, I don't need to be a world-class expert to teach, but going through that process is what makes me a world-class expert. That's the key distinction here. So now you can see how all of these things can stack. For example, in the residency system, I had attendings who were teaching me. And so I would look up and be like, wow, these attendings are so amazing. They're so good. Like, thank you for like teaching me. But they became that way because they were teaching. They went through all this process too. And they had their group discussions. They practiced their craft for years and years. And now they were teaching. In residency, we had didactics as well, where we'd have lectures. And so we would have group discussions on those topics. And then we would be practicing by seeing patients every single day. And it shifts from, for example, in my first year of residency, I was in the inpatient rotation. And so when I was in the inpatient rotation, I was with another resident who was a 4th-year resident. The attending said, hey, you're going to be staffing to the 4th-year resident now. Meaning that like if I see a case, I'm going to go to the 4th year and ask them what I should do. And they're going to be the ones who are making the decisions for the unit. And then the attending was kind of like the overall supervisor. But now you see how both of us were learning there. I was practicing by doing, seeing the patient and like trying to come up with treatment plans and diagnoses. And he was learning by teaching because he's already gone through the practice by doing. So now he's teaching me and he's realizing like the gaps in his knowledge from that. So if you can figure out how to learn this, if you're a student, trying to especially do the practicing by doing, if you have group discussions and now you teach that topic to other people, like let's say you become a tutor. Tutors are one of the best. They're going to learn that shit down cold. Then you can do mini lecture series. Like you might talk about like this reaction in chemistry, and then your friend will talk about other reaction in chemistry. And then that's how you learn. In the medical field, they have us give presentations. So like case studies, or like, let's say I'm on a medical rotation. Well, what will happen is that we'll ask the med student, hey, come in and do a 5-minute talk on depression. So then the next day the med student comes in, does a 5-minute depression talk, and then they will teach. And that's how they get to learn too. So this is the fundamental framework in how to really learn psychiatry and how to just learn any kind of healthcare field in general. So whether you are in undergraduate, whether you're in medical school, you're in NP school or PA school, you're practicing, understanding this and leading towards the active is what's going to really help you become a master clinician. And so if you really want to learn more about how to become an excellent psychiatric nurse practitioner, the best way to do that is in our NP coaching program, where we've had over 160 people go through so far and become confident in their psychiatric diagnoses, treatments, and actually helping patients get better. So if that interests you, you can check that out, and I'll see you in the next video.